Hello, my name's Dr. Vicci Owen-Smith and I'm the Clinical Director for Public Health here at the CCG. What I wanted to tell you today about my role is I'm responsible for the health of everybody in Stockport. And what's really important to me is that everybody's health is the best it can be, but more importantly that the inequalities in health across Stockport are reduced, because the life expectancy between some areas of Stockport and other areas in the borough is over 10 years difference, and more importantly than that actually is the number of years that people live in miserable chronic ill health is very different across different areas of the borough. So how do I do that? I suppose the most important thing is working with you, working with the public to improve healthy behaviours. There are 4 really key healthy behaviours that will make a difference to everybody in Stockport, and in making that difference it will make you feel good about yourself and feel better in yourself. But more importantly then, as everybody's health improves, we need to spend less money on healthcare, and the money we spend can be spent in making sure the services are really high quality. So the 4 things I'm talking about is not to smoke, and we can, me and my team have lots of services to support people who are smokers to reduce the amount they smoke, and again across Stockport the difference is 40% in some areas and 7% in others of smokers. The second is around being more active. Actually, if everybody in Stockport did 5 lots of 30 minutes exercise, so 30 minutes a day for 5 days, chronic disease would reduce by 40%. I mean, that's really significant. And it's not difficult. What I want people to do is just put walking into their everyday. So if you drive to work, park 15 minutes away, walk to work and back, and that's your 30 minutes. And seriously, that would make a difference into how you feel about yourself and in yourself. It has huge dramatic benefits in terms of your mental well-being. And I suppose what I'm looking for is people to try it, to feel good on it, and then to enthuse others about it. The other 2 things are around eating as healthily as you can, and I'm not suggesting that we all need to diet and be meticulous about what we do eat. But for example, giving up refined sugar or giving up snacks, you'll notice a difference in a couple of days. And the last one is to drink sensibly, and what I recommend is everyone having 2 to 3 alcohol-free days in a week, because that can make a dramatic difference to how you feel. So I suppose what I'm trying to do is working with you, with the public in Stockport, to try and get people who've tried this, who've done it, who feel better, to enthuse other people. And the benefits will be huge in terms of not living your last 20 years of life in ill health, and being able to be fit to look after your grandchildren and to play in the park with them and whatever else. The other thing that my job involves is looking at how we pay for healthcare and what healthcare we buy, making sure that what we buy really meets the needs of the people in Stockport, and that where people need it more, they get more of that healthcare. And particularly making sure that what we buy is really good quality and value for money, so that we spend our money on services that make a difference to people and that are really worth spending our money, because there isn't an endless pit of money, and we've got to be very careful about what we buy. So I suppose the last thing I wanted to say is, as a plea to anybody out there who has made a change to their lifestyle, who wants to share what they've done with other people and inspire other people, we'd be really keen to hear from you, because we want the public of Stockport to start empowering themselves and others to take care of their health, and for me, to live a healthy old age.